Nearly a month after the state of emergency was declared, Kashechewan First Nations community members are scattered throughout Ontario, and a solution is still in the works. The several hundred people remaining in the fly-in community of Kashechewan may soon be without medical care. The medical staff are pulling out soon, a month after a state of emergency was called in the Northern Ontario community of about 2,300 people.
Once the confirmation of the cryptosporidium was in the water supply, Health Canada, I think, and their health teams decided that they have to remove their nurses out of the community. The paramedics will follow.
Indigenous Services Canada says the community's nurses are expected to depart today, but that orange air will be on standby if needed. The residents who are choosing not to evacuate will have to drive about an hour away to Fort Albany Hospital for care.
Roughly 370 people are still there. We're starting to make plans to get these individuals or these families out of the community.
Evacuations began last month when a state of emergency was called after the community's water treatment system failed, sending sewage into people's homes and contaminating freshwater systems. Late last week, tests confirmed the parasite cryptosporidium was found in the community's water system, the same parasite that made more than 60 people sick.
It doesn't take much of this infection to ingest to actually get us sick. And the primary syndrome of this infection is a gastrointestinal syndrome.
This latest incident comes after the community found E. coli in their water in 2005. And while engineers are looking at solutions, so far there is no timeline for when the water will be safe enough for the community to return. And even then, Wesley says trust in the water has eroded.
It is going to take some time, a lot of time for people to regain that trust.
Indigenous Services Canada says there are plans for access to alternative health care, including virtual care for residents. The department says that the nurses will start returning to Kashechewan when the community members do as well.